Welcome, everyone. Thank you for tuning in to today's Brown Bag webinar. My name is Monica Gao. I am a founder and executive director of Wake Up Narcolepsy, and I will be your host today. At today's session, we will listen to Amy Dougrey's presentation about school and work accommodations for people living with narcolepsy. Amy Dougrey is a parent and family educator in the neurology department at Boston Children's Hospital. With a master's degree from Simmons College in special education, moderate disabilities, pre-K to 8, and years working in public schools as a special educator and case manager, Amy helps families navigate the education system, consulting on a case-by-case basis and working with parents who have an array of disabilities. In addition, patients who have an array of disabilities. In addition to her work in several clinics with the neurology department, Amy assists in the BAC-PAC program, which is Bullying and Cyberbullying Prevention and Advocacy Collaborative with neurologist Dr. Peter Rafali as an educational consultant. Before I turn it over to Amy, I would like to thank our generous sponsors who make the Brown Bag webinar series possible. Thank you to Avadel Pharmaceuticals, Harmony Biosciences, Jazz Pharmaceuticals, Orexia Therapeutics, and Takeda Pharmaceuticals. And lastly, one more thing before we start, I need to read this disclaimer. Wake Up Narcolepsy seeks to raise awareness about medications and treatments for people with narcolepsy so that they can make better informed decisions for themselves and their families. However, Wake Up Narcolepsy does not endorse or recommend any medications or treatments or make any representations or warranties as to the content, accuracy, or completeness of the presentations. Wake Up Narcolepsy is not engaged in rendering medical advice, and if you have narcolepsy or think you might have narcolepsy, you should consult with your doctor to fully investigate treatment options to meet individual needs. Today, we will ask you to put your questions through the Q&A feature at the bottom of your Zoom screen. Amy would like to field questions periodically, depending on the level of the amount of questions. So we're hoping to stop after each section, but please put your questions through and we will get to them for sure by the end. So, and with that, I will turn it over to Amy Dougrey. Welcome, Amy.
Thank you, Monica. I'm just going to share my screen really quick and get started. All right, so narcolepsy accommodations, school and work. Monica gave my introduction, so no need to worry about that. Table of contents is pretty broad. We just wanted to make sure that we kind of touched upon what we will be looking at today so that people that are kind of beyond the school age know we will get to the workplace accommodations, so hang with us. We'll go over school support. We're going to go over elementary school through high school accommodations, college accommodations, and then workforce. So narcolepsy is a very misunderstood, misdiagnosed, stereotypical, there's stereotypes for narcolepsy if you watch certain movies and whatnot. And patients with narcolepsy are 4 times more likely than other patients to receive a misdiagnosis. Often it's looked at as mental health problems, depending if you have cataplexy. Sometimes they think you have epilepsy, could be insomnia or some other sleep disorder. And why is that? Lack of awareness by healthcare providers. Research says that 39% of PCPs can't actually identify narcolepsy symptoms. So it's definitely kind of an elusive diagnosis. Oftentimes it overlaps with other symptoms, sleep disorders, other medical issues, and some psychiatric symptoms. And right now in this culture, excessive daytime sleepiness, fatigue is really prominent. So that often gets mixed up as well. And it can manifest as attention problems, memory issues, hyperactivity, behavior problems, and that we especially see in children. Problematic presentations for us are impulsivity, emotionally labile, you're up, you're down, hyperactive, a lot of times irritability, students are talking back, somewhat aggressive behaviors. Back to cataplexy, sometimes teachers will think that a kiddo is smirking or sticking out their tongue when actually they have no control over that, and it becomes a behavioral issue. Mood problems, nearly 25 to 33% of pediatric patients report depression and or anxiety. This is really sad. They're often called lazy and unmotivated. This one kills me. Accused of being on drugs. A lot of high school age kids are accused of that. And then it's really hard for them because they're not understanding what's happening to them. And because symptoms often develop in the second decade of life when you're a teenager, your identity is being formed, and it's really impactful to your self-esteem and not always in the best way. School problems, there are a high rate of academic difficulties among patients with untreated narcolepsy. They have difficulty paying attention and staying focused. They're easily distracted. They may appear fidgety because they're trying to stay awake. They can be forgetful. They may not complete tests or homework due to falling asleep. One of my favorite stories for a patient that we had in the sleep clinic was she said she was in the middle of taking a test and then woke up, but didn't realize she fell asleep. And the only way she knew is because there was like a line streak across her paper. And she was like, oh, so luckily she had extended time so she could finish her test. A lot of times students will look bored or disinterested, and they're actually just falling asleep. And there's a lot of times they have frequent requests to go to the nurse's office for a plethora of reasons. School support is so critical. Even with treatment, students will have high degrees of sleepiness. Patients report chronically feeling like they've been sleep deprived for 1 to 2 nights. So adequate support is needed to prevent school failure. And we'll go over these, but that can be in the form of a 504 plan, an IEP, an individualized healthcare plan. But school and family support is absolutely necessary, helps the student cope with the diagnosis, and potentially helps with mood problems, before they happen. So 504 plan versus IEP. I'm sure so many of you are familiar with this, but we're just going to do a quick review. So 504 plan is the Section 504 of the Rehabilitation Act of 1973. And then there is the IEP, which is an individualized education program. 504 is actually a civil rights statute that says schools cannot discriminate against children with disabilities. No federal funding for this. And this is a really big. Eligibility is determined if the disability impacts a major life activity, breathing, walking, learning, seeing. In 2008, it actually added sleeping. So that was great for our narcolepsy patients. What I think is often confusing for parents and even some of our providers, for a 504 plan, you don't get a diagnosis and then automatically qualify for a 504 plan. It has to really impact a major life activity. So we'll get into more details in that in a little bit. And then you're given accommodations through the plan, which makes it possible for students to reach the general education curriculum with supports and services, scaffolding almost. And as it says, levels the playing field. One of the best examples that I can think of is if you have a young kid or a toddler that needs to brush their teeth at night, or wash their hands and they can't reach the sink. What do we give them? We give them a stepping stool, and that is an accommodation. So that's basically what a 504 plan is. An IEP, that is the Individuals with Disabilities in Education Act. And it makes sure that children with disabilities have access to a free and appropriate public education. That is your FAPE. This is extremely important. It is federally funded. IEPs have usually quarterly progress reports are sent home. There are services, accommodations, there's measurable goals, objectives. It's a full legal document that is an entirely detailed plan for your student. And so unlike, or in addition to a 504 plan where you have accommodations, an IEP also provides your student with modifications, whether that's services where they have a paraprofessional or a TA push in for services, or they're pulled out for services. It can be many different things that are modified. But what's important about an IEP is it is tailored to meet the need of each individualized student. There should be no 2 IEPs alike because there's no 2 kids alike. You'd be very close, but not quite. So we want to make sure that the IEP is tailored specifically to those kids. So educational plans for narcolepsy, 504 plans are usually the most sought after and strongly recommended. It brings awareness to the diagnosis for the school staff, the teachers. Like I said, it's often misrepresented, so it's really important. It permits helpful school and testing accommodations that can be utilized when necessary, allows students to better access the general ed curriculum, and it takes the pressure off the student and helps them get sufficient amount of sleep in this particular case for narcolepsy. You can also look into an individualized healthcare plan that's done by a provider. And then again, the IEP is needed if a student needs their education to be modified or accommodated. 504 plan process. So anyone can refer a child for consideration for a 504. That can be a parent, a doctor, a teacher, school nurse, family friend. What they'll have to do then is the schools have to consider a variety of sources. Oftentimes doctor's letters, clinic notes. A lot of times we'll write letters saying, our providers will write letters saying that they recommend a child be on a 504 plan. They'll look at the grades, the teacher reports, information from parents. And I will stop here and say parents are so important. I know sometimes, unfortunately, parents will go to meetings and they're made to feel completely unnecessary or not like they're not part of the team. And that's unfortunate because parents are a huge part of the team. They are part of the team, no matter what anybody makes you feel. And you know your kid. There is, parental instincts here. And so don't be made to feel like you can't contribute to these plans. Your input is just as important as anybody else's, and you hold the cards. They can't do anything without you. So I always want to tell parents that, because sometimes they're just made to feel so useless and intimidated, and it's just unfortunately not the way it should be. Some schools will look at standardized test scores, discipline reports, attendance records. So they take all of that in, and then no formalized testing is required, which we'll get to for an IEP. But that the school staff then kind of takes all of this information to see if this disability is there and if it is majorly impacting a life activity, whether it's sleep, and in most cases for schools, it's learning. I have an example from one of our providers, suggesting accommodations. You want to make sure you have the symptoms of narcolepsy, your current treatment options, how narcolepsy affects quality of life. You want to highlight the student's unique circumstances if necessary, and suggest specific accommodations. The schools are in charge of the 504 plan. They are in charge of the accommodations, but it doesn't hurt to have a medical professional say, this is what we recommend. So this is just an example of a letter that we send home about this. So when is an evaluation necessary? So a special education, because we're switching gears, and Monica or Tammy, just let me know if there are questions, I can stop. A special education team evaluation is only necessary once the team exhausts all other interventions. Much kind of like just a 504 plan in general, this is often very confusing for parents and doctors alike. Sometimes with the diagnosis, they think they automatically get an IEP. And I've actually had to teach many a neurologist, that's not the way it works. We have to try a bunch of steps before we get there. And so we're often teaching our providers who back in the day used to write a letter and that's the end of that. And what they said was gold. And it's just not that way anymore. So it's really tutoring them on what actually needs to happen. So usually a teacher or a para who works closely with a kid will note the student is struggling. So they start to collect data. Data is super important in special education. So they implement their own interventions, extra help, individualized attention, maybe some fidget toys or a disco seat if they're getting a little wild. Where are they placed in the classroom? Would they do well if they partnered with a, kind of a mentor, student? So that's kind of the first thing, is we look into like small interventions. If the interventions don't seem to help, a lot of times teachers will bring this particular student to something called like an educational support team or a teacher support team type thing. And this panel of teachers kind of brainstorm interventions to create generally like a 6 to 8 week plan with specific accommodations and supports to see if they can bring that student back up to grade level. It's kind of a team approach. And then again, they'll collect data and review after a certain amount of time. This is also called like response to intervention. You might hear that buzzword. And then, if teachers notice improvement, they might continue with those supports and interventions. Doesn't generally cost the school any money, so you just keep going. If effective progress is not noted, they may tweak the plan and try another, route moving forward to see if that helps. But, after a few interventions, the kid's still not making effective progress, then they'll move towards speaking to the family about an initial special education evaluation to see if their education needs to be modified to help them access the curriculum. So team evaluation. So no matter who makes the referral, parent or legal guardian must give their consent in writing. It's got to be a formalized letter. A lot of providers will have template letters that parents can just edit and send home. So that's always important. Doctors cannot make this recommendation. I'm going to go over a few timelines, and those are subject to change depending on if you live in a different state. I'm using Massachusetts right now. The school generally must contact, if they get the letter, they must contact the parent within 5 school days of receiving the referral to let them know whether or not the district will conduct the evaluation. Most of the time, the district is going to conduct it. There are some times where a district will balk if a kiddo is doing really well, getting great grades, seem completely fine. But it's generally pretty rare that they would say no, but it does happen. Evaluations then must be completed within 30 school days of parental consent. One thing that's always great to note is that you can, as a parent, request all evaluation reports 2 days prior to your teen eligibility meeting. This is not a given, so you have to know to request those. And that just gives you a chance to look over all of the evaluation reports so that you have time to process and ask relevant questions. Or if you have an advocate or a lawyer, you can give it to them. And then you have team meeting, which is an eligibility meeting, and that's going to be held within 45 days of consent. So what parents can ask school districts to evaluate, these are pretty much the general ones. They are psychological evaluation, which is basically your cognitive abilities. They look at your full scale IQ, processing speed, working memory, verbal comprehension, that kind of stuff. Academic evaluation, these are your basic building blocks, math, reading, writing. Occupational therapy, that's going to look at a child's fine motor skills, oftentimes visual motor, and sensory issues. Physical therapy is going to be your gross motor skills. Speech language is a big one. That's a huge umbrella one. That will look at your, if necessary, social skills, expressive and receptive communication, vocabulary, pragmatics, sign language, augmentative communication devices. It can also look at feeding and swallowing, see if further evaluations are needed. So that's kind of when you ask for a speech language evaluation, and like a lot of these, as you ask and the provider starts conducting the testing, they might say, oh, you know what, I'm noticing this weakness, I'm going to add these kind of tests. So it could kind of expand, and addendums sometimes are needed at a later date. And then some people can ask for assistive technology assessments, and that determines what software or tech tools best support a child's access to the curriculum. It can be really simple, like speech to text, text to speech, or it can be obviously much more in depth than that. So determining eligibility really comes down to 3 things. Does the child have a disability? Does that disability cause adverse effect? And does this student require specifically designed instruction to make effective progress in order to access the curriculum? If eligible, the team will then develop an IEP. If not, it's most likely going to result in a 504 plan with continued accommodations, but not special education. We're going to go on to accommodations next. I'm going to list accommodations. A lot of them are very much geared towards elementary age children. So obviously accommodations that I mentioned might not be socially acceptable for middle or high school kids. So just take into consideration what your kiddo or you yourself feels comfortable with, and just think outside of the box in order to find strategies and tools that work for you or your kid. Some of these are going to, you have a high schooler, they're not going to be the paper passer outer. Well, I mean, they could, but most likely they're not going to want to. So accommodations, we're going to go over whole class movement breaks, individual movement breaks, naps, classroom environment, sensory stimuli to maintain wakefulness, and the curriculum. Some of these things that I have up top are great little accommodation pieces. You got to be careful if you have a kiddo with cataplexy or somebody that, falls asleep pretty regularly, because you don't want them on a wobble stool and then they're, falling to the ground. But again, think as you go. It's a whole class movement breaks. This is really big for our little kids. It's been discussed that movement helps to fight off fatigue and stimulate the brain. Therefore, we encourage teachers to allow walks, breaks, and give their students access to a variety of tools that encourage such movement. I don't know one teacher that doesn't do movement breaks right now. It's like the only way you can keep your sanity. There's some fabulous websites out there, gonoodle.com, Thinking Moves, Stand Up Kids. These are great opportunities for kids to do yoga, for them to sing along, to dance, to do whatever. A lot of times, my personal favorite is Go Noodle. My kindergartners that I used to have as students loved this because you got to build a monster as you progressed in your dancing and movement. But also incorporating movement in classroom teaching through kinesthetic learning. If you think about Gardner's 8 intelligences, kinesthetic learning is definitely one of them. I personally learn very well through movement. And so that's really important because not every kid learns the same. And that'll help our narcolepsy kids stay awake more. Individual movement breaks, they tend to be expensive, but access to stand-up desks, that's where you get to stand and the desk is a little bit taller and there's usually a little swing for your feet. So that's great. Notes to nowhere. This was a personal favorite of mine. I would make these ahead of time. And if I noticed one of my kiddos was a little fidgety or needed a break, and in this case, if I had a narcoleptic student, give them a note and it's stapled shut and just tell them where to go. And the next teacher opens it up, signs it, and sends it back. And it literally just says, Joey needs a break. Please sign and send back to room 205, which is my example. It just gives them a chance to get out. Then the other teacher or teachers that the kid encounters in the hallway know that he's on a break. Classroom helpers, like I mentioned earlier, paper passer outer, hand out materials, note deliverer. I used to get pumped when I got to deliver, the lunch choices in the morning, that kind of stuff, get to go down to the cafeteria, really wild times. And then older kids should be permitted to take walks, get up and move their bodies, maybe stand up in the back of the classroom, during a lesson or whatnot. But just anything to really move their bodies to stay awake. For our narcolepsy kids, naps are so important. It's really important and is suggested to schedule naps. Obviously, they can fall asleep if they need to, but it's, love to get it on a schedule. 2 15-20-minute naps at a nurse's office or other designated space is extremely helpful. Generally, if kids are allowed to sleep a little longer, it's difficult to wake them, so we try to keep them in a specific window. We see that naps are most often needed around 10 a.m. after you've been learning for a few hours, and then after lunch. So classroom environments, cool environments, have access to a fan, or if the school is able to have access to air conditioning. Obviously, if it gets, warm, you kind of fall asleep. Access to movement breaks. TheraBands and bungee cords are huge for our little guys. You tie them around the front legs and they can literally run a marathon while nothing's happening up top. Fidget toys, disco seats, wobble stools, anything that promotes movement. Allow patients to sit in front of the class if their attention is needed. But if they're often a kid that needs to fall asleep, maybe sit them in the back of the class so they don't draw so much attention to themselves and they can take brief little naps. Allow them to chew gum and or keep water bottles at their desk. Some teachers have a really hard time with the gum chewing because Johnny doesn't get to have gum. And that really comes down to being able to differentiate. That's the onus is on the teacher on that one, if the kid chews gum appropriately. Allow students to leave sweatshirts or blankets at school for naps so they can be comfortable. And, creating a designated nap area. When you're in your elementary school days, you used to have a reading corner and there are beanbag chairs and pillows and blankets. Let's not worry about lice, but a nice place for kids to kind of lay their head down and create a safe and comfortable environment for them. And then sensory stimuli to maintain wakefulness. Again, access TheraBands and bungee cords around legs of chairs, standing desk, disco seat. Obviously, this is a lot of the same stuff. Fidget toys. One thing that some of our kids love is just Velcro under the desk, and they just run their hands along that. And then sitting on an exercise ball. And then one that's huge is the ability to color or draw. Again, a lot of teachers have a hard time with this because they think the kid's not paying attention, but they actually are because they're moving their body and their brain is able to focus. And basically that's how I got through grad school, to be 100% honest with you. I used to doodle and I'm pretty sure it did not make a lot of professors happy, but once I got into school with special ed, they were like, oh yeah, no, that makes total sense. And then curriculum, kinesthetic and interactive learning, incorporating movement. Notes and or lessons plans provided to students in case they miss important information. For younger kids, flexibility with homework. Sometimes they can barely make it through the day, let alone a pile of homework at night. So let's be really flexible in that. Extra time to make up homework, study period or block, as you get into the older grades where you have a lot of times rotating schedules. Morning classes, afternoon activity, encouraging gym and recess, modified homework schedule. Maybe it's just we do our homework on specific days, or maybe it's just we do our odd problems or you do the even problems. When it comes to homework, it is quality, not quantity. That's definitely changed over the years since when I was in school. Stop clocks and timers are great. Only work for this amount of time and, working, not messing around. Allow recording of lessons or lectures, modified classwork, priority scheduling, obviously for, our older kids, first period study hall for kids that have trouble waking up. They can sleep in, or midday study hall if you need a nap. You want to make sure your most difficult classes are when you are most alert. Sometimes you can't help that, but if you can. And then one thing, as we kind of move towards high school, it's when you start thinking about college and all of those really fun standardized tests. So as soon as you can, it's really important to start thinking about accommodations for standardized tests like the ACTs, the SATs, PSATs, and your AP exams if you're in one of those classes. The sooner you start it, the better. Having accommodations at school on like a 504 plan or an IEP don't necessarily guarantee accommodations for those kind of tests. It can be helpful to show, again, data that you need these things, but you'll need to provide documentation, of your diagnosis, how narcolepsy affects you, asking for specific accommodations. And each exam is different. So you want to check with your school guidance counselor or look at those websites for detailed information. This is not something that happens in a month. I mean, you need to be really well prepared. There are some times where we have families, they're like, oh, we have the SATs in a month. We need these accommodations. That's just not going to happen. So you need to be really prepared for these. And if you think you don't need these accommodations, I would highly recommend that you get these for your kids or for yourself, because you don't want to be having them sit in these miserable tests and realize, oh crap, I need so-and-so. But then that brings us to college. Monica or Tammy, any questions? We're good? Great.
You're good.
Okay, good. College accommodations. So things are different now. You are now responsible for disclosing your condition to your school so that you can receive accommodations. So again, much like those other tests, it's really important to start early. This is no longer the school district's responsibility. The onus is now on the student. And that's a big shift because, high school, middle school, elementary school, you are the public school district's responsibility. And if something doesn't happen, that's on them. They are out of compliance with special education or, civil rights statutes. But now college is a whole new ballgame. You are totally responsible for yourself. So you really need to be a strong advocate for yourself. Sorry, I just got kicked off. To find out how to request accommodations, visit the college website, contact their disability center. Sometimes it's called something different. If you're unsure about the procedure, get in touch with an admissions officer or even your counselor. To request narcolepsy accommodations, again, you're going to need to provide documentation from your provider that confirms your diagnosis. It should include what academic accommodations are necessary for a condition. Speak with your doctor ahead of time to discuss. Again, this is not something that on August 20th, and schools starting in September, that you can just hit up your doctor for. Some doctors don't get back to you that soon. Some colleges require a lot of information in these letters. So it is best to, again, think ahead. College is very different than high school in what is required for your doctor's letters. So give your provider ample time and have an idea of what you want, what you need as a student. If you qualify, you're going to receive an official letter outlining the accommodations you'll receive. And if you have the option or you want to, you can touch base with your professor. You can email them ahead of time, request an in-person appointment, or even literally just take 5 minutes after your first class. Introduce yourself, give them information about narcolepsy and yourself and just how you plan on being a successful student in that class. Like I said previously, some people just don't know a lot about narcolepsy. So the more information they have, the better it is for you or your child, because it's just oftentimes, what Hollywood said as it is. So narcolepsy considerations in college. So this is huge. So you need to learn your sleepiness schedule. Ask yourself these questions. Do I become more tired in the morning? Am I more tired in the evenings? What do I eat that makes me want to take a nap? How many hours am I awake till I start to feel tired? What activities make me feel more alert? And then what activities make me tired? So that's really important when you're considering everything. And then just take advantage, I cannot say this enough, take advantage of the disability centers on campus. They are there to provide you tools and resources to help you be successful. Every place is different. So you make sure you ask about all the services that they offer. It could just even be like study groups. Who knows? Colleges have so much out there, so many resources, and it would behoove you to take advantage of this. And even if you find that it's not really that helpful, you at least have somebody to contact if you have questions moving forward, and they want you to succeed. So that's really important. College accommodations, some examples: extended time on tests and quizzes, the age-old accommodation. Priority scheduling, this is huge. It gives you the ability to sign up for classes ahead of the general population in order to get the classes that you want and need when you are most alert during the day. a lot of college kids are in charge of their own schedules. And this just gives you like a jump start on everybody else. Like you get first dibs, and that's huge. Multi-day testing, so like testing over a few days, flexible deadlines on assignments, note-taking assistance. You know, can you record a lecture? Can you take pictures? Exempt from tardies and absences. We usually do not like this one. It isn't recommended. We don't write those at Children's, even for our narcolepsy patients, but sometimes college classes are just at 8 a.m. and there's nothing you can do about it. There is no flexibility. So sometimes if that's needed for your major, then it might be an accommodation that's necessary, because 8 a.m. comes early when you are in college. Find a place to nap on campus. You know, is there a student center? Is it a large campus? Is it a small campus? Can you run back to your dorm and take a nap? But find places that you're comfortable, the library and stacks, any place that you can just doze off for a good 15, 20 minutes or 5. Highlighted textbooks are an option. You know, if it's challenging for you to remain awake and alert when you're reading, you know, you can look at highlighted textbooks. Allows you to focus on the important information, reduce a little bit of the reading. For kids with cataplexy, students with cataplexy, you know, first floor classrooms, or make sure the building has an elevator. You know, you don't want to be on the stairs and have something happen and you're all of a sudden tumbling. So it's just something to think about. You know, obviously they're not going to be able to accommodate that, you know, but it's just something, some food for thought. Text to speech, speech to text software, find a study partner, study groups. You know, if you miss something, you can go to them and they can kind of, you know, help you get through a class. Access to class notes, PowerPoints prior to class. When the lecture's over, you can chat with your professor to get the information you missed. Campus living. I thought this was actually very, I didn't think of it when we first started this presentation and I started putting this together, but I thought this was really important. So you have to think about when you're going to college, do you want a roommate or do you want a single? There are pluses and minuses to both, but you really need to think about one, yourself, and then you really need to think about if you had a roommate and how it would affect them. So you need to think about your sleep schedule. Are you an early bird or are you a later gator? Are you going to be up all hours of the night and you have a roommate that likes to go to bed at 8? Do you need a shaking alarm or strobe lights to wake you up? Because that could affect them as well. You know, obviously having a roommate is fun in college, but if you're somebody that, you know, sleeps like the dead and needs everything to wake you up, it might not be that great for a roommate. So just kind of take that kind of stuff into consideration. A lot of times we have students ask for bathrooms attached to a room. This is great because when you wake up in the middle of the night or you wake up from a nap and you're kind of out of sorts, it would be a real challenge to walk or stumble down the hallway if you have to go to like a co-ed or a you know, community bathroom. It would be much easier and safer, really, if the bathroom was attached to the room. So that's just something to keep, you know, in mind. Access to an air conditioner. And then this is really important. Talk to campus housing and campus safety. Let them know that you have narcolepsy and what medications you're taking, because in case of an emergency, they need to know to go wake you up or to go get you and save you. For a million different things could go wrong, and people just need to know where you are, and that, you know, that's really important to ensure your safety. So I would definitely encourage parents and or your students yourself to just talk to those two departments at college. And advocates are not generally used for high school, you know, for college, but I'm going to go back to it. We get these questions a lot about advocates. And when do you think about looping in an advocate? Which is no, you know, it's a big thing because it costs money. And it can be stressful, but some people just get an advocate just because. I've worked at a school district where there was an advocate or a lawyer at every single IEP team meeting, and that was just the norm. They just, honestly, they had the funds and they could have it at every meeting, and what a luxury. Oftentimes we'll tell families to loop in an advocate when the school isn't following a plan. I usually say there's this gray area where you have this incredible IEP or you have this great 504 plan. It just looks awesome on paper, and then it's not implemented in the school. And now you've got this situation where it's a he said, she said, the school saying, oh, we do this, it's in this plan. And the kids saying, oh, it doesn't happen. And that's where I always say, an advocate would be really helpful. Somebody to go to these meetings, literally advocate for you and your kiddo, and not let anybody kind of run you over. Because like I said at the beginning, it can be really intimidating. And so you kind of want somebody in there to really, stand there for you. And when you're starting to pursue special education, again, it can be very beneficial to make sure that everything is free and appropriate, that FAPE for your kiddo. Where do you find them? Your state's Department of Education, an online search, referrals. You can ask your PCP office. If you have a neurology office that you go to, maybe there's resource people like myself that'll have a long list of advocates. And sometimes on the Department of Education, depending on the state, they will have an entire list of them, or they'll also have some sort of resource guide that will have these at the end. So that's really important. And then narcolepsy in the workplace. The American with Disabilities Act only protects you if your employer knows about your condition. So that was actually pretty surprising to me when I read that. You're not required to disclose your narcolepsy to your employer, but if you don't inform your supervisor, your sleepiness may be seen as laziness or a lack of motivation, or maybe go back to what I said earlier and they think you're on drugs. So you want to make sure that you are protected. And employers can and they will deny requests that provide an undue burden on the organization. Usually accommodations don't cost money. So the company will be required to make reasonable accommodations under ADA, but they usually don't cost money. If you're asking, to put a window in because you want the natural light to keep you awake, I mean, that's probably not going to happen, and that's a little costly. But other things that we'll go over, they're not going to cost the employer any money. You'll obviously be required to provide a doctor's note that confirms your needs and your confirm your diagnosis and what you need to make it through the day and to, at this point, access your work. And you should really just know your rights under ADA, and then even the FMLA, the Families and Medical Leave Act, because you can take intermittent FMLA, but we'll touch upon that briefly. And I don't know too much about that, but I know it's an option. So there are a lot of workplace accommodations. So I just kind of chunked them out. Schedule short naps, 3 to 4 hours, every 3 to 4 hours during the day. Take a nap at lunch. Permission to stand at meetings, permission to get up and walk around when you're sleepy, move your desk near a window, or maybe they have access to full spectrum lighting. A wellness room, or even sometimes they have nursing rooms where you can take a nap. Obviously, you need to get permission to do the nursing room, but flexible arrival time, or moving to a morning or afternoon shift so that you can kind of stay on a regular sleep schedule. Move less interesting tasks to times when you are most alert. For me, that is first thing in the morning. If there is a mundane task to do in the afternoon, it just is not happening. Flexible working hours to avoid peak traffic. You do not want to be sitting in horrendous traffic and be tired and then fall asleep. So you want to think about that. If you can work from home, that's great. COVID made that possible for a lot of us. So hopefully that's more available to a lot more of you. Now, not taking shifts where you're closing at night and then need to get up and go into work the next morning. Keeping a consistent shift rather than rotating. You might have to talk to your doctor if nothing's working about changing the timing and doses of your medication to fit your life and your work schedule. And if you do shift work, scheduling it for when you're most alert. Or, if it's not a shift schedule and you're a salaried employee, then, find a schedule that works for you. Maybe they don't care if your schedule is, 10 to 7 kind of situation. You know, sometimes they don't care as long as you just get the work done. So it's really worth it to have these conversations with people because you never know how flexible a place is. Take breaks that meet your needs, whether it's longer ones or shorter ones, frequent, option to break up repetitive, monotonous tasks throughout the day, scheduled walk times, a standing desk, that one, work instructions provided both verbally and writing so you don't miss anything, permission to record meetings, flex time. So paid time off to arrive late to work when you're having trouble waking up. And like I said, I mentioned briefly, this can be granted through intermittent family medical leave. So FMLA protections, they kick in, what does it say? Working for a company for more than a year and then for more than 1,250 accumulated hours. Driving, I just kind of threw this in there. I thought this might be good to touch base on. So in a survey of 64 narcolepsy patients, 48% reported falling asleep while driving, and 25 reported a car crash due to drowsy driving. And then only 4 stopped driving after an accident. So that's something to keep in mind. The National Institutes of Health website reports patients with untreated narcolepsy have a 10 times increased risk of having a car accident than general population. So you want to be on the road when you have an idea of when you're alert. And so that I just feel ties in very much with, being in the workforce, or even if you're a college kid that is, not living on campus and commuting to school, think about that when you're scheduling your classes. Each state has very different laws surrounding driving guidelines, kind of like, epilepsy as well. You have to know what the state rules are. Is your doctor a mandated reporter? Are you the mandated reporter? Examples that I have: Massachusetts, your physician is required to report it if there are concerns of impaired driving or public safety. And then licenses can be given back at a specific time period if you've shown that there are no further concerns or an improvement in sleepiness. Usually this is with treatment. New Jersey, I know, has mandatory physician reporting and citizen reporting. And then Colorado, the patient is actually required to report conditions. So you just want to look at the state that you're in to see, if you need to report that and if it needs to go on your record. And then it's just final thoughts. If you think you or your child don't need accommodations, I would think again. I think you do. It's better to ask for them and not to use them than to silently or loudly struggle. You can get these plans and you could have 100 accommodations listed. It doesn't mean that you need them every day. You don't need, you don't have to use them, but they are there to protect you and allow you to access what you need to if it's necessary. And so what's important is think about what you or your child needs on your worst day. That's what you need to think about when you're like, oh, do I want to tell my supervisor at work? Do I want to tell my teacher I'm doing so great? I don't, I'm not feeling tired. But think about the worst day you've ever had with your narcolepsy. What does that look like? And what did you need, or what could you have used to get through the day? And I think that's really important, because when things are going great, we don't think about that kind of stuff. But when things are not going great, that's all you can think of. And it's important to also remember there is no cure for narcolepsy, but treatments need to be tailored to the individual patient, just like the plans that we discussed. And so those are kind of my final thoughts and the presentation.
Excellent, Amy. Thank you very much. This was so much information. We did have somebody ask if the slide deck would be available after, and I know we've already talked about that being available on the Wake Up Narcolepsy website. We have a couple of comments or questions, I guess. Jack is asking and stating, one of the things I struggle with is how much to tell my manager and coworkers as far as details. For example, people love to guess what it is when I'm vague and say I have a condition, and I state what accommodations I need. When I'm specific and I say, hey, I have narcolepsy, it's much more helpful, but I know I'm not required to say my condition, and it can be detrimental.
Yeah, I mean, that's going to be up to each individual person. Really, it's none of their business. Hopefully he's close with those coworkers. Otherwise, that's really inappropriate. Hopefully that's not his boss asking those questions. But I think it's up to each individual person. And, it's kind of like school, like, need to know basis. It's a need to know basis. If your supervisor is the one that needs to know, your coworkers don't, because it doesn't affect them. But again, it's a personal preference. But it's really nobody's business, honestly.
Thank you. Ben is asking, do you have suggestions for finding colleges with better accommodations for students with narcolepsy?
That's a really great question, actually. There are certain colleges out there that are known for really great special education type services, but it's state dependent, and so you kind of have to do your research on that one. The person that should know that kind of stuff are your school counselors, who you should be meeting with if you are a high school sophomore, junior, or senior as you approach college age. They obviously see so many kids that are going to different colleges, so they should have a really good idea of what might be a great fit, and I would start with them. And if you have a PCP or a neurologist, if they have a resource person, you can reach out to them. If you're seeing a neurologist for narcolepsy, they're obviously going to have a lot of, if they've been in it, they're obviously going to have patients that have gone on to college and done that. And, when you're doing your annual appointments, doctors ask about school. And so if they might have positive feedback for, oh, my prior patient went here, they loved it. It was great accommodations, really helpful. So it's kind of, you got to do your research, you got to ask the right people, but I would definitely ask your school counselor and your neurologist to start. And online, I mean, honestly.
Right. Yep. Thank you, Amy. Chelsea's asking, is getting a written plan for work accommodations from a large organization helpful when transitioning to other jobs? She currently works as a grad student at a university.
So is a formal plan? Is that what you're asking? Is that what
I think
it is?
she's asking for, should she get a written plan?
I don't think it would hurt. I mean, I would have whatever is at your current place, whatever you have as your accommodations, I would definitely get that in writing, because it shows that that's what was necessary for you to do your work. And I'm a big believer that put everything in writing, no matter what it is. So it's just more data, it's more information that kind of helps. So even if you have to write it up yourself and have somebody sign it, at least they know that is a plan that's in place and this has worked for you, and you're not just willy-nilly asking for accommodations that don't make any sense. So I don't think it needs to be, crazy formal, but I definitely think it would help to put it in writing for sure.
Great, thank you. Any other final questions for Amy? Oh, somebody's saying great job. There is a lot we can share with our clients here in Germany. So thank you very much.
Oh, cool. Yeah, you're very welcome.
Anything else before we wrap up? This recording will be made available also. And as I mentioned, the slide deck too, I know it's one of those things where it's nice to go back and actually look through some of this stuff and absorb it and kind of dissect it. But somebody's asking if you can share your contact info.
Yes. Where would you like?
Do you want to send it through the chat? I think you can send it through the chat.
Can. All right. So, I'll just give my email real quick.
Yep.
And I might not be able to get to, everybody. They have to be patients at Children's Hospital, but sometimes if there's something I can help consult on, I can absolutely do that.
Oh, this person's daughter is seen at Boston Children's, so.
Perfect.
And she's happy to know that you exist.
Yeah. I work very closely with Kieran Maskey, who's one of my favorite human beings of all time, and Dr. August.
Oh, excellent. Anything else before we wrap up? Oh, one more, hang on. Oh, she can't see the email address. Hang on a second. Let me try to get it out.
Oh, you know what? It's sent to hosts and panelists. Hold on.
That's okay.
I only have the ability to do that.
Yeah.
So you might have to send it for me.
There. Oh, hang on a second here.
And you can also, even if you don't get my email address, whatever provider that you see, you can, ask them to hook, connect us.
I'll get it right here.
There we go.
Okay, excellent. So one last thing here coming in. Okay, she said. So I think we're good. Again, thank you, Amy. This was excellent. So much great information and guidance, and it's a lot to think about. So we definitely, yes, a lot of thank you. So thanks again, and I appreciate all your effort and work put into this.
All right, thanks, Monica.
All right, thank you everyone for attending. Have a great afternoon. Bye-bye.